Right, switching gears to the NDP. So in keeping with the theme, the NDP is talking about hospital funding, mental health funding, pharmacare, dental care, long-term care. So essentially it's very similar to what was in the budget.
Right.
And I've said on this show earlier, the NDP's game plan seems to be, if you're sick of the Liberals, but you like this stuff, you can vote for us and get the same stuff, but not have the Liberals.
Right. There's some variation with respect to mental health spending. It's a little bit slower under the NDP platform than and it's a little bit more aggressive under the Liberals. The NDP is far more aggressive on dental care than the Liberals are. So there's a little bit of variation there, but in general, very similar platforms.
All right, so the NDP, I think, though, is talking more broadly about dental care.
Right.
Whereas the PCs are focused in on low-income seniors, and the government, the Liberal government, had a kind of limited, almost like a benefits plan.
Mm-hmm.
What's the NDP talking about? I talk about broad-based coverage, right?
Absolutely, and it is a different way of going about it. The NDP wants to put forward a new Ontario benefit, whereby employers and employees would cost share for those who don't currently have private insurance, would contribute towards a benefits plan that would defray the cost of dental care for that population. Those with lower incomes would not have to pay the copay, would not have to pay the premiums, but those with higher incomes would have to pay it. So it's an interesting way of going about it. It's going farther than any other party, and it remains to be seen how this is going to be rolled out. Right now, they've costed it at $575 million, above and beyond the premiums that they would receive. So we'll have to see how it works out.
All right. What else have they got on offer? What's kind of the highlights of the NDP health platform?
Going further on dental as well, they also will extend the Healthy Smiles program, or various public programs that currently exist for those who are under the age of 18 to those over the age of 65, to seniors. So very similar to the Tory, to the PC platform in that regard as well. So they intend to put forward more resources than the PC party.
All right, and have they put out a number on long-term care?
On long-term care, 30,000 beds.
So that seems to be the magic number for all the parties.
Right, but again, they intend to move forward far more aggressively than the Liberals. I believe they said 15,000 beds by 2023. So it's about within 5 years, 15,000 beds. So very similar to the Doug Ford campaign platform.
Yeah, the parties haven't really created a lot of daylight between themselves or among themselves in terms of who will do what on health care. I'm not sure that, quite frankly, the parties have been as creative or have looked as widely or broadly as they might have.
Yeah.
Certainly we have seen other professions that are beyond physicians. And we should say too, that's kind of what hangs over all of this stuff, is that the Ontario Medical Association and the Government of Ontario are going to arbitration. Right. And the government has been reluctant to adjust funding models for other professions because that could be used as a precedent in the arbitration process. So, if you are another profession and you were in line maybe for a 4% increase, you've had to wait because the government didn't want to give you a 4% increase, because then the OMA would go to arbitration and say, look, they gave them 4, they should get us 4 as well. So it's been kind of a hang up there in a lot of the funding decisions. But having said that, we do work for the pharmacists, and we were proud to work extensively on the flu shot in pharmacy program. And that came about because the pharmacists made a rational case for why it should be allowed. We didn't have to convince the Ministry of Health on the benefit of immunization. That's done. And the government runs a flu program every year anyways. But we said, why not extend it? The legislation allows for it. There's a regulatory college that developed a regulations package. Modest funding was agreed to. And last year, 1.2 million people got their flu shot in pharmacies. It's safe, it's convenient, it's accessible. You can do it on a Sunday afternoon if you happen to be in the pharmacy for whatever reason. And they're looking at it and saying, well, we could do more. We're qualified, we're trained, let us do more. Certainly we have done some work with audiologists on the question of testing screening for hearing loss, particularly among seniors. Good idea.
Yeah.
Regulated by a college. We have dentists who are looking and saying, well, you know, we want to be an active participant in these discussions. So my message, our message to the political parties, I guess, would be it's great that you put this stuff out there and say we'll do this and we'll do that. Probably be a good idea to consult in a meaningful way with the actual providers, the people that are out there on the front lines and would be having to do this.
Absolutely. I mean, if none of the other parties, the NDP or the PCs, aren't putting out a figure in terms of how much they would give a raise to anybody, but what they did, their criticism of the Liberals is that they haven't managed the stakeholders as well as they could have, and the relationship with the doctors is one that sticks out and one that gets constantly brought up by Doug Ford and by Andrea Horvath. And so meaningful consultation is absolutely critical. Right now, Doug Ford is being criticized for the lack of a costing platform, and where is he going to find the savings, especially within the healthcare system? But at the same time, there are significant opportunities for savings within the healthcare system. If you take a look at things a little bit more holistically, I think that this was also brought up with respect during the debate between Christine Elliott and the healthcare debate on TV Ontario between Christine Elliott, Deb Matthews, and Franz Jelena, that investment in things like chronic disease, prevention, other healthcare professionals, these are things that can reduce downstream costs and also reduce the pressure on hospitals and reduce and potentially deal with the issue of hallway medicine.
Yeah, I think we're going to come to a fork in the road pretty soon. The Ontario budget now is $150 billion a year. 61 billion of that is on healthcare, providing healthcare for 14 million people. You know, we talk about sustainability, which in our view is the affordability over the medium to long term. We talk about how sustainable is our healthcare system. I think whoever wins this election will have to, out of necessity, sit down and look for other ways and other efficiencies and maybe spreading things out a little bit so that we don't have people lined up. I think the polling indicates that, generally speaking, people in this province are pleased with the quality of the healthcare system. They just really hate waiting for it. Yeah. So it shouldn't take 7 months to get your hip replaced from the time you're diagnosed. I think everybody agrees with that. Question is, what are the ways that the government and providers together can come up with to alleviate some of those pressures? And if we maybe distribute the work a little bit outside of hospitals and physicians' offices to other professionals, that would help, I think, to alleviate a lot of that pressure, and in a way that's, quite frankly, cheaper, safe, accessible, convenient, and people will get the health care that they need so that maybe your mom can get her hip replaced in less than 7 months. You know, maybe we can get it down to 3 months. But I think it behooves the parties to have meaningful consultations. And I'm not talking about, we've all seen it. Look, we're in the government relations business here. Meaningful consultation is not, you know, we'll give you a meeting, we'll take notes in one of those black hardcover books and thank you for coming in and send you on your way. Yes, you met with them, but no, that's not meaningful consultation, I say with respect. So whoever wins this election is going to have a healthcare challenge, and they should know that the providers out there are really, all the ones I've talked to are willing participants. Everybody wants a better system. Nobody wants to be the one to give up their money to do it, but you need not necessarily do that. Like there are ways that they can work together. So rather than looking at these provider groups as stakeholders to be managed, let's look at them as partners to be meaningfully consulted with and collaborated with in order to deliver a better system. I don't think I'm dreaming in Technicolor when I say that.
I mean, this is all hands on deck. I mean, I think everybody wants to see the system be sustainable, and people do want to deal with the aging population that's currently putting a strain on the system. The first of the baby boomers turned 65 in 2011. So right now that 65-year-old is 72 years old. And so I think that's something that all parties are going to have to deal with.
Yeah.
The more they consult and the more they consult with folks on the front lines, the better it is.
Last thing I'll say before we wrap up is the Government of Ontario and the Ministry of Health in particular needs to do a much better job at adopting new technologies. These new health technologies are coming out weekly. The challenge is some of them are expensive, but the Ministry of Health needs to be able to look at a new technology as something that will help the patient instead of what we did in 1972. But they tend to look at it as in addition to what we've been doing since 1972. They need to change their way of thinking at the ministry, and for anybody watching at the Ministry of Health, sorry if that offends you, but we live this stuff every day, and you really need to get your thinking into this century. Anyways.